Coming to the male reproductive system, the reproductive functions of male can be divided into three major subdivisions, which includes spermatogenesis, that is nothing but formation of the sperm, performance of the male sexual act, and third one is the regulation of male reproductive functions by various hormones. Blood testis barrier, the tight junctions between adjacent Sertoli cells near the basal lamina form blood testis barrier. These creates a specialized immunological safe microenvironment for developing sperm. Steroids can penetrate this barrier with ease. Major germ cells pass through this barrier as they move to the lumen through the formation and breakdown of these junctions. Functions of blood testis barrier prevents large molecules from passing from interstitial tissue and the part of tubule near the basal lamina. They are also important for maintenance of composition of fluid in the lumen of seminiferous tubules, like that is they maintain little protein glucose but rich in androgens, estrogen, potassium, inositol, glutamic and aspartic acids, so which eventually depends on the presence of blood testis barrier. Blood testis barrier protect the germ cell from the blood-borne noxious agent, and it also helps in to establish an osmotic gradient that facilitates movement of fluid into the tubular lumen. This structure showing the blood testis barrier, where they are made up of Sertoli cells and mainly the tight junctions between the Sertoli cells and thick basal lamina. And you can see the Sertoli cells harboring the different stages of spermatic cells. Coming to spermatogenesis. Spermatogenesis is a process by which new spermatozoa are created from spermatogonia is called as spermatogenesis. In human, it takes on an average 74 days. The estimated number of spermatids formed from single spermatogonia is 512. Phases of spermatogenesis. The first phase is phase of mitotic division of spermatogonia. Here, spermatogonia divides mitotically 7 times to form 128 spermatogonia. The second phase is phase of formation of primary spermatocyte by maturation. 128 spermatogonia undergo maturation to form 128 primary spermatocytes. They are large cells with a diploid number of chromosomes. The third phase is phase of formation of secondary spermatocyte by first meiotic division. During first meiotic division, that is reductional division, 128 primary spermatocyte is converted into 256 secondary spermatocytes with a haploid number of chromosomes. Fourth stage is phase of formation of spermatid. Each secondary spermatocyte undergoes second meiotic division here, similar to the mitosis, to give rise to spermatids. Thus, the total of 512 spermatids is formed having haploid number of chromosomes. Fifth phase is formation of the spermatozoa. Spermatids do not divide further but undergoes morphological changes to form sperms or spermatozoa. Spermiogenesis is conversion of spermatids into the sperms. This process takes place within cytoplasm of the Sertoli cells and depends on the presence of androgens. So these are the different stages of spermatogenesis. Primordial germ cell, they remain quiescent till the puberty, and after puberty they starts dividing by mitosis, and then they will form the primary spermatocytes. The primary spermatocytes by meiotic division 1 they get differentiated and converted into mature sperm. Factors that are influencing spermatogenesis. Testosterone. In high concentration, the testosterone is essential for growth and division of testicular germinal cells, which is the first stage in forming sperm. Luteinizing hormone, it is secreted by anterior pituitary gland, helps in stimulating Leydig cells to produce testosterone, which is essential for spermatogenesis. follicular stimulating hormone, is a key gonadotropin for spermatogenesis. It is secreted by anti-pituitary. It helps in the conversion of spermatid to sperm by stimulating Sertoli cells to produce some local factors. Growth hormone is necessary for controlling the background metabolic functions of the testis. It especially promotes the early division of spermatogonia themselves. Then estrogen is formed from the testosterone by the Sertoli cells when they are stimulated by follicular stimulating hormone. They are also essential for spermatogenesis. Sertoli cells, which secretes androgen binding factors or proteins, inhibin and mullerian inhibiting substance. They do not synthesize androgens but contain aromatase, the enzyme responsible for conversion of androgens to estrogens, which helps in the process of spermatogenesis. Androgen binding protein helps to maintain high stable supply of androgens in the tubular fluid. Inhibin inhibits FSH secretion, and the mullerian inhibiting substance causes regression of the mullerian duct in male during fetal life. The seminal fluid with fructose content help in the maturation of the sperms. Vitamin E, C, and several members of B complex are required for normal spermatogenesis. The general factors which affect spermatogenesis are temperature, where optimum temperature at around 32 degrees Celsius is maintained for the process of spermatogenesis. Radiation sometimes can degenerate seminiferous tubules. Vasectomy and age are the other factors which are going to affect the spermatogenesis. As the age progresses, the spermatogenesis regresses. Some of the hormones which are necessary during the different stages of spermatogenesis. During the stage of proliferation, follicular stimulating hormone and growth hormone plays important role. During the stage of growth, testosterone and growth hormone plays important role. At the stage of maturation, testosterone and growth hormone, whereas during stage of transformation, testosterone and estrogen, they play